Hi, everybody. Jack O'Malley here with you. This Monday update coming to you. I'm recording this a little early. I've been watching the revenue estimating conference, and I haven't gotten a complete picture, but I have an obligation this evening, so it's just easier to do this now. So I'll touch base on some things. I'm sure there will be a lot in the news over the next 24 hours about the revenue estimating. Just to give you a frame of reference when you start to hear all of this, in the spring, in March, they were estimating that our revenues were going to be down about $3 billion. $2 billion to the general fund and $1 billion to the school aid fund. Now, as we started to slowly open things up, revenue increased a little bit. So there was some hope that our deficit wouldn't be as big. I was kind of hoping that they would talk about what that deficit was going to look like while I had a chance to listen in, but I did have to scoot. But one of the things that I did pick up was that the economists and those folks chatting really don't expect a robust, quick return to where we were at. They are all assuming, from what I picked up, mid 2021, late 2021 at the earliest for us to kind of get back to where we were this past year. A couple of things that I thought were interesting. They mentioned that we'd be even a bigger hole than we are, but all the federal monies, the CARES Act money that went to people, the PPE money or PPP money that went out, did keep money in pockets. So retail sales and whatnot didn't dip exactly as much as they could have if that federal money wasn't there. The question is, will the federal money be there moving forward? I don't know. And I know people, well, it's federal money. But remember, whenever you say federal or the government will give us money. Just remember, the government is you and me with the taxes that we pay and the fees that we pay. So when the federal government will give us money, just remember that's us giving us money from the federal level. So that money's got to come from somewhere, and it comes from us by way of taxes and fees and all that good stuff. So if the federal government can continue to give money, I guess that's great, but then the question needs to be asked, where are they getting it? Many believe they're just printing it, which isn't good either. So you can think through this yourself. I think you know my train of thought here. But the federal money was huge in keeping us even afloat. That's what I got out of it. But they are saying the jobs that will be the slowest to recover in 2021 are the, let's see if I can read my writing here, leisure, hospitality, services, and retail. Those will be the slowest to recover next year. Leisure, hospitality, services, and retail, which is pretty much my entire district. So you can see why I've been a supporter of safely, smartly getting our economy going as quickly as possible. On Wednesday in our COVID Oversight Committee, we're bringing in some more folks business owners who have not been able to open. And one of those, I'll tell you more on Wednesday, one of them is from my district in Mason County. You're going to hear from them. And also a gentleman who is a stone's throw outside my district, who has a business that has been hurt by our governor's handling of the COVID situation. So again, lives are important, health is important, but so is our economy, because our health and our well-being, and I'm going to get to that in just a second, are tied to that as well. And with these tight restrictions, I believe in balance. We need to have balance in these approaches. Michigan hasn't had it. And again, leisure, hospitality, services, and retail will be slow to recover. All right, so I give you a couple of stories here. I chatted with a gentleman over the weekend who owns a gym, fitness center in Dowagiac, I believe is where it is. He is a constituent of a friend of mine and a representative colleague, Brad Paquette. And I reached out and talked to him. He has kept his, well, actually, he opened it back up about 2.5 months ago. He opened up his store because he said, you want to fight COVID, you want to keep people healthy, let them exercise. This is a respiratory illness. And what better way to build up lung capacity than cardio work? And what better way, we're all a little obese. And that's a thing that hurts people too. So you want to keep people safe from COVID, get them healthy, right? So he opened up, and he is now sitting on a pile of $18,000 in fines from the city of Dowagiac because he has flaunted and gone, nope, I'm opening up because saving people's lives by keeping them healthy and keeping their mental health solid is so very important. And he gave me some statistics that I thought were interesting, and I'd share them with you. In 2018, this was the last year that these numbers are available. In 2018, 1,548 people in Michigan took their own lives. A recent study by a large mental health provider predicts a 32% rise in suicides in our state due to COVID-19. Pine Rest Christian Mental Health identifies everything from job loss, social isolation, and alcohol sales as known factors for this rise. They also warn that frontline medical workers are at risk. Kids depend on social interaction. That is also being denied. So his question is, why are gyms being closed when they could do everything to help fight mental fatigue, obesity, all these things which compromise your health when dealing with the COVID? So it's interesting. I paused because I was reading one of my chicken scratches there. I want to continue on a couple of things. Got this note from a constituent. Says, I want to tell you, I dropped my daughter off at college yesterday. I've never seen anything like it in the college world. It's so sad. My daughter doesn't know a soul. She's isolated and a single because of COVID. Almost all classes are remote. Any introduction to school is over Zoom. School areas are closed. Eating room is limited. Carry out is recommended. No one is allowed in your room. She's already begging to come home. She feels so isolated and alone. The governor is saying she is saving people, but this writer believes she's killing people on a daily basis. So I talk about balance, right? I want to give you a couple other statistics here. Where do I want to start? Okay. Michigan coronavirus dashboard. This is from the state. 25 to 35,000 COVID-19 tests are being administered a day. Let me repeat that. Between 25 and 35,000 people are tested a day. 3% have a positive result. So let's just split the difference. Say 30,000 people a day, 3%. That's not that many. 3% positive results each day. That number has stayed steady since May. Hospitalization is also very, very, very stable. Interesting. Sunday, 768 new cases reported, 4 deaths. The 7-day average for new cases, 581, is down from 759. So, there have been 96,792 confirmed cases of the COVID in Michigan as of yesterday. 72,580 have recovered. Think about that. 10 million people, 96,000 got the COVID, 72,000 of them and change have recovered. This is not the death sentence to the average Michigander. We do have to take care of the vulnerable groups, etc. But again, we need to think about this rationally, and we need to move forward smartly and safely. And I leave you with this thought. In today's world, we like it simple. We want sound bites. If it's in a meme on Facebook, we share it because it says it all. It says it all. Because it's easy to digest sound bites, memes. Science and data, science and data, science and data is a soundbite that never gets explained, never gets shown. We are to just understand that it's science and data. But there is so much more to the coronavirus than just the governor's science and data. And that is the problem when you have a unilateral regime like Governor Whitmer and has taken out all discussion from the legislature. If you oppose the governor, you're shouted down. And that's unfortunate because so much of what's happening in our society right now is if you don't go with the narrative, you are shouted down. Which I'll go back, I wasn't thinking about this, but I thought about it in the past, so I'll throw it in there. I grew up in the 60s and early 70s, all right? And I remember the campus revolts. And I remember the chants and the long-haired hippies on the campus, you know, with the peace symbols on their back and then the army jackets and the long hair. You know, you couldn't see their faces because the hair was like this. And you know what their main cry was? Don't trust authority. Don't trust authority. Authority is lying to you. Now, flash forward 40 years. Those same long-haired hippies are in charge. And you know what they're saying as authorities? Trust me. Ironic as hell, ain't it? So let's move forward. Let's question. Let's ask, where is the science and data? Ladies and gentlemen, if you're scared, I get it. But ask those questions. Don't be afraid. Don't blindly follow. Listen to both sides. Understand balance. Nobody wants anybody to die. Nobody wants anybody to get the COVID. Nobody. But we've got a young girl already sad and scared at college because they won't let her talk to anybody. I've got a gym owner who's being fined 18 grand already by a city who says you can't be open. You can't be open helping people get healthy. So remember, the hippies of the 60s are now in charge. Back then they said don't trust authority. Today they're saying, I'm the authority. Trust me. Interesting. Have a good evening. Talk to you on Wednesday.